Namaskar and welcome to ITV Gold. I am Pia Jyoti Khatru and today we have the second session of CWC, Crack the Wellness Code, as part of the Healthy You series of AAPI focusing on heart health, diabetes, and obesity. All these three ailments pose the biggest health hazard for South Asians and the Indian community. So we are indeed fortunate to have four accomplished physicians to tell us how to apply lifestyle medicines to these health challenges to live a healthy and happy life. And all four are CWC doctor patrons who helped in seeding the wellness movement in San Francisco Bay Area that is going global. Right here, I have with me Dr. Sam Suri, MD, MBA, FACC, associated with West Coast Medicine and Cardiology in Fremont, California, attending Washington Hospital, Fremont, California, networks with UCSF Medical Center and Stanford Medical Center. Next, I have with me Dr. Srinivas Ramachandra, MD and vascular surgeon, engaged with multiple clinics in San Francisco Bay Area with 48 years of medical experience, helping needy patients worldwide with volunteer time for surgery and cure. And next, I have Dr. Soham Patel, MD, endocrinologist and lifestyle medicine specialist, member, American College of Endocrinology and Lifestyle Medicine. And I also have Dr. Naris Bhatt, board certified specialist in internal medicine, obesity medicine, sleep medicine, metabolic cardiology, allergy and immunology, and biofeedback. Practices integrative medicine at his own 7 multi-specialty clinics. He's an author, professor, and one of the founders of South Asian Heart Center. So let me welcome Doctors Sam, Ramachandra, Soham, and Naris. It's a pleasure to have you on ITV Gold. And I want to start with Dr. Sam. So, Dr. Sam, tell me, as a cardiologist, what do you think lifestyle medicine has to do with heart health, and what's your take on it, especially when it comes to applying to your patients or educating the community?
Oh, thanks for giving me the opportunity to be here and with a very significant number of very astute physicians and clinicians who know this area probably far better than I do. But I know that in my own practice, I have a very broad base of internal medicine and cardiology type patients that I see. And on the cardiovascular side, what I enjoy most is preventive cardiology. With that in mind, I look at an individual from a patient's perspective, looking at a triad of health concerns that they may have, which would include either predisposition to diabetes type 2 or type 1, or hypertension or lipid abnormalities. So a combination of this would include the triad that I'm always looking at. And some of them may have one factor or a second factor or a third factor or all of the above. And so when they come in as adult patients with these sort of risks, whether there's a family history or not, I want to be able to sort of think about how to kind of treat these patients with a combination of diet, exercise, weight loss regimens, and then go on from there on to looking at other genetic factors, and then also look at some objective assessment of that, which we can kind of elaborate on a little bit more. So that's the platform that I operate from.
Wonderful. So my next question goes to Dr. Ram. Dr. Ram, as a surgeon who has to, undertake highly involved and painful procedures, what will be your message to the community regarding the benefits of lifestyle medicine and what difference, it could make in their lives?
Thank you, Pia. Heard you say painful surgeries and complex surgeries. It's very true. There's a lot of pain involved in surgery, unless you're talking about cataracts. As the old saying goes, no pain, no gain. So why put yourself through it? I've been in practice for over 40 years, both as a general surgeon and as a vascular surgeon. I would say over 75% of the surgeries that I performed over the years could, to some extent, have been prevented. It is especially true in vascular surgery, where the causes are clearly identified and they're known. I mean, smoking's the number one cause. Then you have diabetes, high blood pressure, and all these can be managed and to a great degree prevent further problems as a result of these conditions. So the goal should be take better care of yourselves and perhaps stay away from the surgeon. In fact, one of my colleagues used to joke with the patient saying, and if they asked him, what if I didn't do all of these? What if I didn't cut out my cigarettes and don't take care of myself? He would say, job security for me. The intent is not that. The intent is to prevent problems and keep people healthy.
Absolutely. I think you said it very well. And yes, I want to ask next question to Dr. Soham. Besides being an endocrinologist, you are also a certified lifestyle medicine practitioner. So tell us how to prevent diabetes through lifestyle and diet.
Yeah, so, I run my practice called Center for Preventive Endocrinology and Nutrition, and that's the focus I go for is prevention. Yes, we can also treat diseases with lifestyle medicine approach, but prevention is always better than cure. South Asian population, the one striking difference that we have is that we don't tend to put on any fat in our extremities. All the fat deposition that we tend to see happens in the middle, in the belly. And technically we call it visceral adiposity. Adiposity is just fat deposition, visceral because it's around the vital organs in the abdomen. And that's what really causes insulin resistance that leads to high blood pressure, diabetes, and all the things that we see all the time. And it's not uncommon for me to see 20 and 30-year-old South Asian patients having type 2 diabetes. So it is something that is not a disease of old anymore. That whole classification, type 1 is young, type 2 is old, is gone. There's a lot of mishmash. So age is not a factor anymore. And like I said, buildup of fat in the middle, which we are seeing growing at a very fast pace, is a very key factor. And simple steps that you can take early on can actually prevent things from getting worse and keep you healthy. The most common impact area is food, and predominantly focusing on a fiber and nutrient-rich whole plant foods way of eating, combined with good sleep habits and a little bit of intermittent fasting. That's the fancy word, but fasting has been done across many cultures for ages. It's not new, but it's being recognized more so with latest research. And so the three of that and some form of activity. It's not like you need to spend an hour in the gym if you hate going to the gym. It's the type of activity that you enjoy doing that keeps you moving. That's important. So eating a plant predominant way of eating, good sleep, moving, and having fasting period where you're not eating till late night. I think those 3-4 steps can make a very big impact and prevent insulin resistance and all the things, including type 2 diabetes, from happening.
Absolutely. And don't you think we need to inculcate those kind of habits from the very beginning when a child is little?
It starts from the womb, actually. So, pregnant ladies, if they have good, if they can maintain a good eating and a good routine as best as possible. Yes, pregnancy comes with its own sets of symptoms and issues. So the best you could do, because you are imprinting genes, for the baby in the womb. And so the earlier you can start, the better it is. And if you can start in early childhood, teenage, anytime you can wake up and start making changes, it's always good.
Wonderful. Thank you. So I also want to talk to Dr. Naras. Dr. Naras, we hear that you are a pioneer of wellness and, adapting simple lifestyle changes to transform healthcare. So what are those changes to begin with, if I want to start right away?
Well, when it comes to lifestyle instruction or lifestyle medicine for my patients, I focus on three issues, three questions. What is lifestyle medicine? Why? And the third is how. So, lifestyle medicine, I ask them to count with their 5 fingers. That is, eating, physical activity, and sleep, stress, and social connection. And once I have listed it, they want to know why, instead of giving pills, I am focusing on lifestyle issues. And the answer is, I tell them, this is the new science of cracking the wellness code, which is, this, if you think of your body in terms of hardware, software, and the printer, the hardware is your DNA, and software is the epigenetics, which is scientifically it is the DNA methylation and histone modification. And this epigenetic modification leads to illness or wellness. And then imprintome, that is Dr. Soham Patel already mentioned, is the printing in your each organ, as a follow-up of your lifestyle change. So the root cause of all diseases is lifestyle, and there are 5 roots, as I mentioned. So let me just cover the 5 in a very succinct way. Eating has 2 parts: when you eat and what you eat. We eat around the clock, but we teach them, you learn, to eat 16/8 intermittent fasting. Why? To reduce your exposure to high insulin level and then all the consequences of it. So then what you eat is, like Dr. Soham Patel mentioned, is a plant slanted whole food. Because many of our patients are meat eaters because, they are taught where is the beef. So we tell them make it plant slanted. Not only that, you divide your plate into 2. First half you feed your gut microbiome by whole food and then the polyphenol or rainbow colored vegetables and fruits. And the other half your indulgence as usual. Physical activity, we have innovated the concept of sedentary life as a sitting disease. Sitting disease kills you, sooner. And in fact, every minute you sit, you die 2 minutes sooner, research shows. And we teach them how to reduce your sitting time, specifically in 3 situations, like computer use, television use, and telephone use. And then the next one is sleep. We teach them how to increase their sleep drive by physical activity and reducing your exposure to blue light, particularly the redundant blue in the computer and the television and your cell phone. And then we teach them about the sleep, of course, we focus a little bit on sleep apnea and insomnia as well. When it comes to stress, there are 3 things you need to know. I tell my patients: 1, the stressor, the factor that causes the stress. The other is the stress reactivity. And the third is the stress resilience, which means how you bounce back from the stress once you had the stress reactivity. By the way, the stress resilience is dependent upon your gut biome, and that again links to how you feed your gut biome. And then finally, social isolation. And we have a formula of time, touch, and talk. You allocate at least 20 minutes a day for a disclosure partner, either real or by FaceTime, and then you share your emotional experience and how the reactivity presented during that, on that day in your body, like a sweating of your palm, racing of your heart, or butterflies in your stomach, and so forth. So those are the key elements of lifestyle medicine. And once again, what we say is, your DNA or genes are not your destiny, and you have full power to modify the software, and that is why we are encoding it and decoding it for you.
Thank you. Very well said. And once again, I want to go back again to Dr. Sam. Dr. Sam, while the standard procedures do apply with patients with heart diseases, so how can one combine that with lifestyle medicine to get the best result?
Great question. First of all, I want to compliment and thank the very eloquent speeches and discussions with my colleagues who certainly have much more experience with non-generic medical therapy that sort of we are ourselves sort of trying to push against over time, because we realize that there's just a limited role of medical allopathic straight treatment, because you need, for this triad that I talked about with diabetes and the other two, hypertension and lipidology, that triad has to be broken, and you have to figure out a way to kind of slow that whole triad down. One of the ways to do that, as I find in my way of treating, is to assess, besides all what my colleagues had said about pure lifestyle and dietary changes, which are very crucial, and also exercise, which I think is just as important, if not more. If you look at all the literature, it's sort of 30-70. 30% goes to diet, 70% goes with activity. That's what literature has sort of talked about. So I incorporate that into practice. But on the preventive side and assessment side, we do some biomarkers that some of my colleagues are very familiar with. Those include things like HSCRP, which is a very important biomarker, lipids of all sorts, including inflammatory lipid markers. And then what we often look at for assessment of diabetes over 3 months is the HbA1c, which one of my endocrinology colleagues will probably talk a little bit more about. So I use this in my treatment panel. And then, of course, if a patient does have some risk for heart disease, I will add a CT angiogram to assess the patient's clinical outcome and their risk associated, only if it's indicated, but not in everybody across the board. And there's a lot of controversy behind it, but I think it's important to kind of incorporate that in practice. In addition, I would, and that's the CT angiogram of the heart, to assess the calcium CT score first, and then assess what the CT of the heart actually shows. So the calcium scoring is important. And there's a whole dilemma behind that. And there's a whole controversy behind that. But I think that it's a very important role, because when you match lipids, which is cholesterol and other sectors of the lipids, you also want to see where that plaque is and what the quality of the quantity of the plaque is within the heart and other organs. Lastly, I will do some functional testing in the right appropriate setup, where a patient presents with, let's say, chest pain, where I will do a stress test. If, let's say, it's a 45-year-old gentleman with a family history of coronary disease and background history of hypertension, diabetes, and other risks, and has some chest pressures I've mentioned, I would certainly do a baseline treadmill test to see where they are in terms of their functional ischemia. And that's where I usually stop, because I think that there's ways to reverse a lot of coronary disease. And I think that there's enough data on that that's now sort of coming out from different diets and types of exercise. And there's lots of literature that will tell us about how to prevent serious heart attacks and heart disease, even coronary disease reversal, with some of the lifestyle changes. So I believe in a lot of that as well. And I've incorporated that in my practice. That's all I have to say at this point, because I'd let my other astute colleagues talk about all of the others.
Thank you. And I want to ask Dr. Ram, after surgery, Dr. Ram, what kind of advice on lifestyle medicine would be helpful for patients? And, great if you walk us through that for our audience to learn.
Great question, Pia. Again, the expert panelists have already elucidated very clearly what steps people need to undertake. First of all, to keep away from us, surgeons. The point to remember is this: for most surgeries, whether I wear the hat of a vascular surgeon or a cardiac surgeon or of a general surgeon, we've taken care of the effects of a problem. We've taken, except in rare situations such as you take out somebody's tonsils, you again never get tonsillitis again, or you take out somebody's gallbladder and they won't have a gallbladder attack. But everything else, we've not done anything to what caused the problem. If you get a coronary artery bypass, we haven't done anything to what caused the problem. If you do a lower extremity or arterial bypass, we've not treated the problem, but we've treated the effect of the problem. In other words, all of the things that were mentioned earlier, it is important to continue that, and maybe at a much higher pace, to prevent recurrence of this problem. In other words, you work with your lifestyle medicine specialist or a primary care physician to keep your blood pressure under control, to keep your diabetes well controlled, more importantly, your weight under control. Obviously, quit smoking, increase your exercise. And the old dictum, no medications but meds, holds very true. MEDS stands for MEDS, which is meditation, exercise, diet, and sleep. So re-emphasize these MEDS so that they change their lifestyle, so that they indeed delay the recurrence of the problem, or as Dr. Suri mentioned, reverse it so that they won't have to have surgery again.